Hello, Frenchie lovers. Welcome back to our channel. There's something undeniably captivating about French Bulldogs, isn't there? Their charming bad ears, their expressive eyes, and that unmistakable snort that melts our hearts, they've truly carved a special place in homes worldwide. But beneath that adorable, quirky exterior lies a breed with unique health vulnerabilities that every owner must understand. We bring these wonderful companions into our lives, showering them with love, and in return, we want nothing more than to ensure they live the happiest, healthiest lives possible. It's a journey of joy, but also responsibility. Unfortunately, due to their specific genetic makeup and distinctive physical characteristics, French Bulldogs are predisposed to several common health issues that can significantly impact their quality of life. Ignoring these signs or being unaware of them isn't an option for a truly devoted Frenchie parent. In this comprehensive guide, we're going to dive deep into the 7 most common health problems affecting French Bulldogs. More importantly, we'll equip you with science-backed prevention strategies, actionable tips, and essential insights from veterinary experts. Our goal is to empower you with the knowledge to proactively protect your beloved companion, help them thrive, and ultimately enjoy many more years of those precious snorts and cuddles. So, let's embark on this vital journey together to unlock a healthier future for your Frenchie. Let's start with arguably the most critical health concern for French Bulldogs, Brachycephalic obstructive airway syndrome, or BOAS. This condition is directly linked to their iconic flat faces and short snouts, characteristics that make them so endearing, yet also create significant challenges for breathing. BOAS isn't just heavy snoring, it's a spectrum of anatomical abnormalities that obstruct airflow. Imagine trying to breathe through a pinched straw all day, every day. That's often the reality for Frenchies with severe BOAS. Common issues include stenotic nares, which are narrowed nostrils that restrict air intake, an elongated soft palate that can block the airway at the back of the throat, and everted laryngeal saccules, small tissues that get sucked into the airway during inhalation. These structural impediments make it incredibly difficult for French Bulldogs to get enough oxygen, especially during exercise, stress, or in warm weather. Signs include noisy breathing, gagging, snoring, and even collapsing. A study published in the Journal of the American Veterinary Medical Association by Packer et al., 2015, highlighted the high prevalence of BOAS in brachycephalic breeds, emphasizing the need for owner awareness and early veterinary intervention. Understanding BOAS is the first step towards managing it, often involving surgical correction to improve airflow, significantly enhancing their comfort and longevity. Don't underestimate the impact of noisy breathing, it's a cry for help. Next up, we delve into the spinal health of our beloved Frenchies. French Bulldogs are unfortunately predisposed to various spinal and intervertebral disc issues, most notably intervertebral disc disease, or IVDD. This condition occurs when the cushions between the vertebrae in their spine, called discs, either bulge or rupture, pressing on the spinal cord. Due to their unique, somewhat stocky body structure and genetic predisposition, French Bulldogs often inherit a condition called chondrodystrophy, which leads to premature degeneration of these discs. This makes them much more susceptible to IVDD compared to other breeds. Symptoms can range from mild pain and reluctance to move, to severe weakness, paralysis, and loss of bladder or bowel control. A retrospective study on IVDD in French Bulldogs by Priester et al., 2017, in the Journal of Veterinary Internal Medicine confirmed their increased risk, particularly in specific regions of the spine. Early signs can be subtle, a reluctance to jump, a change in gait, or sensitivity when touched on their back. Prevention involves careful handling, avoiding strenuous jumps, maintaining a healthy weight to reduce spinal stress, and using a harness instead of a collar to prevent neck strain. Understanding their spinal vulnerabilities is crucial for preserving their mobility and preventing painful, debilitating episodes. Moving from internal to external, let's talk about those adorable wrinkles. While French Bulldog skin folds are undoubtedly part of their charm, they also create a perfect environment for skin fold dermatitis. These deep creases, especially around their nose, mouth, and sometimes at their tail base, can trap moisture, dirt, and bacteria, leading to irritation, infection, and a condition known as pyoderma. The warm, moist environment within these folds is an ideal breeding ground for yeast and bacteria, causing redness, inflammation, unpleasant odors, and intense itching. If left untreated, these infections can become chronic and very uncomfortable for your Frenchie. The key to prevention and management lies in meticulous daily hygiene. Gently lift each fold and wipe it clean with a soft, damp cloth or a vet-approved medicated wipe. Ensure the area is completely dry afterward to prevent moisture buildup. For deeper or more stubborn areas like the tail pocket, a cotton swab might be necessary. Some Frenchies may also require medicated shampoos or topical treatments prescribed by a veterinarian to control yeast or bacterial overgrowth. Regular checks of their skin folds should be part of your routine. Early detection of any redness or irritation allows for prompt treatment, keeping your Frenchie's skin healthy and preventing discomfort. Don't let those cute wrinkles become a source of pain for your furry friend. Just like humans, French Bulldogs can suffer from allergies, and they're surprisingly common in the breed. Allergies in Frenchies often manifest as skin problems, leading to intense itching, redness, hair loss, and recurring ear infections. These can be caused by environmental factors like pollen, dust mites, or mold, known as atopic dermatitis, or by certain ingredients in their food, referred to as food allergies. The immune system mistakenly identifies a harmless substance as a threat, triggering an inflammatory response. Identifying the specific allergen can be a detective mission, often requiring elimination diets for food allergies or skin testing for environmental ones. A study published in Veterinary Dermatology by Bajwa et al., 2020, on canine atopic dermatitis, while general, underscores the genetic predisposition of certain breeds, including French Bulldogs, to develop these conditions. Management typically involves a multifaceted approach. For environmental allergies, this might include regular bathing with hypoallergenic shampoos, antihistamines, corticosteroids, or newer immune-modulating drugs. For food allergies, a strict novel protein or hydrolyzed protein diet is essential. It's crucial to work closely with your veterinarian to develop a tailored management plan, as untreated allergies can lead to chronic skin infections and significant discomfort for your Frenchie. Paying attention to their scratching habits and skin condition is vital for early intervention. Moving to their strong little legs, patellar luxation is another common orthopedic issue for French Bulldogs. This condition occurs when the kneecap, or patella, dislocates or slips out of its normal groove in the thigh bone. While it can occur due to trauma, it's often a congenital or inherited condition in French Bulldogs, meaning they are born with a predisposition due to malformation of the bones in their leg. Luxation can affect one or both knees and is graded from 1, mild and occasional, to 4, severe and constant dislocation. You might notice your Frenchie skipping a step, holding a leg up for a few strides, or exhibiting intermittent lameness. A study by Vidoni et al., 2015, in BMC Veterinary Research extensively reviewed patellar luxation, identifying genetic components and breed predispositions, with French Bulldogs frequently cited. Over time, patellar luxation can lead to pain, arthritis, and further joint damage if left unaddressed. Prevention largely focuses on maintaining a healthy weight to reduce stress on the joints and providing appropriate, low-impact exercise. Early diagnosis through veterinary examination is key. Depending on the severity, treatment options range from conservative management with pain relief and physical therapy to surgical correction to stabilize the kneecap. Ensuring your Frenchie's mobility and comfort means keeping an eye on their gait and seeking veterinary advice at the first sign of limping or unusual movement. Those soulful French Bulldog eyes can also be prone to specific conditions. Two of the most common are cherry eye and Entropion. Cherry eye, medically known as prolapse of the nictitating membrane gland, occurs when the gland of the third eyelid pops out and appears as a red, swollen mass in the inner corner of the eye, resembling a small cherry. It's often genetic and common in brachycephalic breeds. While not typically painful initially, it can lead to dry eye and discomfort if left untreated. Entropion, on the other hand, is a condition where the eyelid rolls inward, causing the eyelashes and skin to rub against the cornea. This constant irritation can lead to pain, excessive tearing, conjunctivitis, corneal ulcers, and even vision impairment. Both conditions have a strong genetic component in French Bulldogs, making them more susceptible. For cherry eye, surgical repositioning of the gland is the most common and effective treatment, aiming to preserve tear production. For Entropion, surgical correction to roll the eyelid back to its normal position is usually required. Regular eye checks are vital for early detection. Look for redness, excessi.